understanding that microcurrent therapy can kind of help counteract some of the negatives caused by the medications. We do know that the body has an incredible ability to heal itself when it's given the right support, right? And one tool that can help counteract it, just one of many, is that microcurrent technology. Because the first thing I would say it can do is it can support detox by stimulating the liver and kidneys. This is, I mentioned this earlier, this is one of the most crucial things that prescription drugs can hurt because as those organs start working, the toxic buildup gets worse and we create more conditions as well. Hello, everyone, and welcome back to another Sana Institute 10-minute training. Today, we're going to be talking about how prescription medications that our patients/clients may be on are sort of blocking everything that we're trying to do. And we're going to talk about why and how we can try and get around that, because it really does change the treatment plan. And unfortunately, it may not be something that we're often even told about by our patients, insofar as exactly what they're on, because they may not think it's relevant. So during this session, we're going to explore this critical topic because it truly affects millions of people all around the world. And the long-term impact of prescription drugs on the body's functionality is something that really just can't be ignored. So while I will admit medications can be life-saving in acute situations, prolonged use, really of anything like this, any kind of substance you're ingesting, can introduce a range of complications. And many of these complications just kind of fly under the radar. So we need to understand these so that we can help our patients make informed decisions. Now, the first thing that I should acknowledge is that this is a very normal part of modern medicine. Whether we agree with it or not, it is there. People are using it all the time, helping to manage pain, regulate blood pressure, control inflammation, even suppress infections. There's a reason that these things are used. It's because they do have an effect, and usually a fairly quick one, that the patient notices. However, these are designed for short-term use. And always, the thing that is not emphasized enough is that the patient should be making lifestyle changes to kind of correct some of these issues. It's like blood pressure, trying to do things to calm yourself down more often and more naturally instead of relying on a pill that you're going to say, well, I'm going to take this for the rest of my life. Because they are only really addressing the symptoms. They're not addressing the root. We have to be willing and able to address the root, which, of course, as practitioners here, is what we do. Now, the body will adapt, and dependence will develop as well. The human body is an incredibly adaptive system. This is part of the reason our microcurrent devices have been built the way they have, in such a way that we mimic the body's own signaling and electrical pathways as close as we possibly can so the body doesn't see it as a foreign substance. When the body is exposed to foreign substances over long periods, it simply adjusts its internal chemistry to compensate, right? If you think about opioids, for example, this is why there's this opioid crisis still going on today, because initially they provide relief because they block the pain signals. And people are like, whoa, I can just live my normal life. But over time, the brain reduces its natural pain relief mechanisms. This means that you need more of the opiate in order to keep your pain down, because what your body was already doing to help you with pain is no longer enough. And it kind of skews its levels. It's thinking, hey, there's a lot of pain reduction going on here. So it lowers it and it goes almost below that threshold. And it will almost never climb back up to that point. The same principle kind of applies to antidepressants, to sleeping aids, even medications for blood pressure and cholesterol. Over time, you're going to need more, and it's going to have an impact. Your body's going to start to resist it. Now, there's also the impact on the organs, and this is possibly the most critical. when it comes to long-term prescription drug use. This is the toll that your detox organs have put upon them. The liver and the kidneys, in particular, are often targeted pretty severely here. And these organs, they work tirelessly to filter out chemicals and toxins, but when they're overloaded with these synthetic compounds for just years on end, their efficiency declines. And this can lead to liver damage, to kidney disease, to a buildup of toxic residues in the body. And this means that without these functioning organs properly, they're not going to be able to push the toxins out. And then there's going to be this toxic buildup, which causes even more problems than we had at the beginning. Now, there's also the effect on the gut health and the microbiome. Kind of feel like those are buzzwords over the last few years, but many prescription medications will disrupt our patients' gut health as well. The gut microbiome is home to trillions of beneficial bacteria that kind of run our body, and they play a crucial role in digestion, immunity, and even our good old mental health as well. Antibiotics, NSAIDs, certain antidepressants, these can just destroy good bacteria. And this leads to issues like leaky gut, to chronic inflammation, and to weakened immune responses as well. Now, there's also an increased risk of chronic conditions, which is an unfortunate side effect because many people find themselves caught in this vicious cycle, right? They start with one med, then they start to experience side effects that require other meds to manage. And over time, they end up with so many medications that they're running the risk of developing new chronic conditions, hypertension, diabetes, osteoporosis, and even neurodegenerative disorders like Alzheimer's and dementia. And then there's the hormone piece of the puzzle. Long-term drug use can also interfere with hormone balance and brain function. Medications like corticosteroids, these can disrupt adrenal function. So your adrenaline is no longer actually there functioning and working for you. This leads to fatigue. This leads to metabolic problems. And psychiatric meds, these can alter neurotransmitter levels as well, sometimes resulting in blunt emotional response, dependency, and even cognitive decline. Now, there's a silver lining in that it's not always getting to the point where it's too late. But this is all to say that we as practitioners will often, especially in the chronic pain space, will often inherit patients that have been beat up by the medical system. And in many cases, they're going to have been on meds before, or they're still going to be on meds, and their doctor's given up on them, and they're just looking for hope. The problem is we're working at a disadvantage. The body's natural systems, right, are at a lower threshold than they were at. And what does microcurrent do? Microcurrent energy medicine, it triggers the body's natural systems. So we have to rebuild that back up. But it's almost like the brain has been shoved in a box, covered up in pillows, and we're ignoring the sounds it's making. And we have to kind of work to reverse that. First and foremost, we know that microcurrent can help to restore the body. But what I want to emphasize is that from a practitioner's perspective, we want to be sure we set an expectation. If someone has been on heavy drug use, prescription or otherwise even, for a long time, there is a muted system we are dealing with. It's not going to necessarily hurt to use microcurrent on them, but what it is going to do is it's going to take a longer time. Those patients that we see where we treat them once and they're like, whoa, I'm totally better. They are likely not on medications. They've not been on long-term meds anyway, and they're able to respond quicker. Patients that have been on medications for decades, there is going to be a slower response to chronic issues. Acute is not usually so much. So just setting those expectations for yourself and for your patients is a great first step. But understanding that microcurrent therapy can kind of help counteract some of the negatives caused by the medications. We do know that the body has an incredible ability to heal itself when it's given the right support, right? And one tool that can help counteract it, just one of many, is that microcurrent technology. Because the first thing I would say it can do is it can support detox by stimulating the liver and kidneys. This is, I mentioned this earlier, this is one of the most crucial things that prescription drugs can hurt, because as those organs start working, the toxic buildup gets worse and we create more conditions as well. So treating the liver and kidneys with 77 hertz or Sanasoft T if you have that mode. These are ways to help to detox and clean the liver and kidneys. As the liver gets more damaged, it becomes scarred. And so you want to be able to neutralize and break up that scar tissue so it can improve its functionality. Now, we also know that microcurrent enhances mitochondrial function. So this improves energy production at the cellular level, and it makes the cells more likely to work. This is often suppressed by many medications as well. We also know that microcurrent can regulate neurotransmitter activity. And this provides relief for people dealing with brain fog, anxiety, and depression from medication-related effects. Now, inflammation can also be caused by medications. Contrary to popular belief, when we think about how they might be removing it, they're often causing it at the same time. And microcurrent, as we know, can remove inflammation. And it does this sort of by sending the right signals to the brain to turn off inflammation, but also by increasing that adenosine triphosphate, that ATP, and improving circulation as well. Because it's not really only helping to manage the pain in this case, but it's also actually moving towards a healing status. So, all of that said, what can we do when we're dealing with patients that are on a lot of medications? Well, the first thing is, and again, always consult your own legal advice on this, but the first thing is never tell them that they have to get off of them. At least where I am, it's considered illegal for me as a naturopathic doctor to tell someone to stop taking their medications, that they have to work with their primary physician to do that or come to that of their own volition. So just be careful about what you say. But I think the important thing here is that we can acknowledge that it's never really too late. We just might take longer to get across the finish line. We know that there are alternative approaches to health. There are ways that don't rely on long-term meds. That's why we're all here. And holistic medicine, microcurrent therapy, proper nutrition, stress management, all of these things can support the body in rebalancing naturally. The goal should always be to address the root cause of the illness rather than just masking the symptoms. If we just try to mask symptoms, we're not truly working on healing. Now, I think I wanted to do this training because I think it's a very essential piece that we often ignore. We don't look at the fact that, hey, all these people are on meds and these meds can slow things down. But I can tell you that one of the first things I ask when I'm in one of my consultations and someone's saying that they're having a hard time getting results, the same results their friend got for the same condition, is what medications are you on? How long have you been on them? And it's almost always the answer is for a long time, and in many cases, a lot of them. Now, again, no doom and gloom. You're not punished. Your patient should not be punished for taking these medications. It's more just an acknowledgement of the fact that it can take longer to heal than it can for someone that's never taken a medication in their life and has a perfectly functioning body and brain that are at that level that's supposed to be optimally natural versus one that has dipped down considerably due to medication use and thinks it's normal, but just isn't. All right, so thank you everyone for joining me today. Remember, our patient's health is in our hands, so the more informed we are, the more we can help people out there. So again, I'm Dr. Rob Vanbergen. Thank you for joining me for today's 10-minute training. I hope to see you next week for another one. We'll be talking about how to help the body eliminate toxins. Very essential as well. Take care, everyone. Bye-bye.